Bonjour tout le monde. C'est incroyable. Justin Trudeau a réussi à doubler notre dette nationale en ajoutant plus à notre dette que tous les autres premiers ministres ensemble, sans pouvoir améliorer notre système de santé. En fait, après 8 ans de Justin Trudeau, notre système de santé est pire que jamais. En fait, certains experts disent que c'est brisé après les 8 ans de Justin Trudeau. Hier, le premier ministre a dit qu'à cause du fait qu'il a dépensé tout notre argent, il n'y a pas assez pour fournir les sommes demandées par les premiers ministres provinciaux pour régler le système de santé. Justin Trudeau a eu 100 millions de dollars pour Mackenzie, 54 millions de dollars pour une application ArriveCan qui ne fonctionne pas, un demi-milliard pour le We Charity, mais il dit qu'il n'y a pas assez pour la santé. Évidemment, il a annoncé des sommes que le gouvernement conservateur que je vais mener va garder en place, mais nous regrettons que Justin Trudeau a gaspillé autant d'argent que maintenant il prive les premiers ministres provinciaux de l'argent dont ils ont besoin pour régler le système de santé. It's incredible that Justin Trudeau has managed to double our national debt and add more debt than all previous federal prime ministers combined without improving health care. In fact, by all accounts, he's made it worse, and some even say our health care system is broken. Health care is broken, and the federal government is broke after 8 years of Justin Trudeau. He had money for the We Charity, $54 million for the useless and broken ArriveCan app, over $100 million for the Mackenzie high-priced consultants, but he doesn't have enough money for health care. And so yesterday he announced sums that are not adequate, according to the premiers, to fix the health care damage that has emerged under 8 years of Trudeau. Obviously, a future Conservative government led by myself will keep in place these additional sums and honor the commitments made yesterday. But we regret that the Prime Minister broke the federal bank and wasted so much money that he now cannot come to the table and help relieve the suffering in our emergency rooms and on our wait lines that have grown out of control under his 8 years as Prime Minister. A Conservative government will unleash the productive forces of our economy so there is more money available to support health care. We will cut the waste and mismanagement in the federal government, including the high-priced consultants, so that more of your tax dollar goes to the emergency room and to treating your family. That's the Conservative approach. Now let's bring it home.
Monsieur Poilievre, est-ce que selon les premiers ministres provinciaux, les sommes annoncées sont inadéquates? Selon vous, est-ce qu'elles sont inadéquates?
Malheureusement, il n'y a pas d'argent. Justin Trudeau a gaspillé l'argent. Il a ajouté un autre 500 milliards de dollars de déficit inflationniste à notre pays. Et il a dit qu'il n'y en a plus. Si j'étais premier ministre les derniers 8 ans, je n'aurais pas gaspillé autant d'argent. Il aurait été possible d'avoir davantage disponible.
Considérant qu'on n'a pas plus d'argent, c'est normal qu'il n'en donne pas plus? Est-ce que je comprends bien?
Mais ce n'est pas normal, la façon dont il a gaspillé notre argent. Il gaspille 54 millions de dollars sur la ArriveCan app, plus de 100 millions de dollars sur Mackenzie et d'autres sommes pour aider ses petits amis libéraux. Et ce n'est pas normal qu'on gaspille l'argent sur ces genres de choses lorsqu'il n'y a pas assez d'argent pour le santé.
Plusieurs demandent à M. Trudeau de bonifier son offre. Vous dites quoi là-dessus? Est-ce que vous lui demandez aussi de bonifier son offre?
Mais Justin Trudeau dit qu'il a déjà dépensé tout l'argent. Ouais. On va regarder, mais c'est probablement pire qu'il dit, malheureusement. Donc, mais écoutez, je ne vais jamais promettre des choses que je ne peux pas livrer. Donc, je vais regarder le dommage que Justin Trudeau a fait après 8 ans à nos finances, avant de faire des engagements financiers. Mais évidemment, le système de santé est brisé et les finances du gouvernement fédéral sont brisées après 8 ans de Justin Trudeau.
So if you would honor, if you want to offer, and where would you cut specifically?
Well, I can't commit to a dollar figure until I've seen how badly Trudeau has ruined the federal finances. We know that he's doubled the national debt, added more debt than all prime ministers combined. No wonder we have an inflation crisis. But we have to find out how broke Trudeau's made us before I can make financial commitments like that. What would I cut? Well, that's an easy question to answer. The high-priced consultants, the corruption, the waste. I cut back on the $15 billion plus that he's giving in fees to consulting firms, and we will put into place a law, the pay-as-you-go law, requiring that my government find $1 savings for each new dollar of spending.
So if you're going to honor these provincial deals on health care, does that mean you think this is a good deal and it's just too late? If it's inadequate, what else do you want to see to try and fix health care?
We are going to honor it because Conservatives never allow cutbacks to health care. When we were in office, under the previous Harper government, we increased health care transfers by 6% every single year, and we always made sure that more money went to health care because we eliminated the waste and corruption of the prior government. So what I will do again is eliminate waste and corruption and protect our health care system.
Would you tie the strings to federal funding? Where do you sit on that? Should the provinces be able to take this money and do whatever they want, or should the federal government be able to direct it aligned with priorities set by the federal government, some priorities you've already alluded to?
Well, I think we should have shared goals, like fast recognition of immigrant credentials. I think it's an outrage that when my little girl sits in an emergency room with a migraine headache for 6 hours because there's not enough doctors and nurses, the government gatekeepers prevent 59% of immigrant doctors from working and 63% of immigrant nurses from working. I think we should team up with the provinces to come up with a simple system that gives a yes or no answer to immigrant professionals based on their tested abilities, not based on where they come from. It should happen within 60 days, not within 6 or 7 years. And we should back up small study loans for our immigrant professionals so they can take time off work and get credentialed. These are the kinds of things I want to team up with the provinces on. It's a low-cost way to get more doctors and nurses. And I know that Dr. Ellis, he has other very low-cost, efficient ways that we can team up with the provinces to deliver better frontline services.
The only condition that you would impose on provinces?
Shared goals. I like the term shared goals.
But the federal government has this in the deal.
Yes, I have met with them. Yeah, I met with Premier Moe and Premier Smith.
And what did you talk about?
We just talked about shared goals of supporting our energy sector, defeating the carbon tax, tackling the inflation that the Liberals have imposed on our country, and fixing the damage that Justin Trudeau has done.
I think one of the things that we need to remember here, folks, is all we're talking about is money. We need to think about the 5 million Canadians who do not have access to primary care, the 1.2 million Canadians who are waiting for procedures in this country. We have the longest wait times that we've had in 30 years. Those are the things that after 8 years of Justin Trudeau spending the cupboards bare that now have come home to roost. Canadians are suffering under this system that he's allowed to lapse. And if you want a solution, what's the solution? It's elect a Conservative government.
That's a good one.
For credentials into leadership, are you